Hi, you guys. Welcome back for our daily practice questions. Happy New Year. As you can see, our thumbnail and cover title page is different. This is the new look for 2025. I wanted to give it a different face so that you can identify out of all of the questions. Since we do questions every day, I know there can be a lot on the channel. So I try to group them together so that you're able to identify one versus the other. As I mentioned on yesterday, under the playlist, you'll be able to see everything that we have done if you're looking just to go back and do a series of questions. But to separate one versus the other, now for this year, this is how our cover page will look. I will adjust colors periodically or add something different so that you're able to tell week by week. Last year, what I typically would do is each week the covers would be the same color. So if the screen, it'll say the same, but the background will be yellow for the full week, or it'll be green, or it'll be blue. You know what I mean? So that you can categorize it that way. So we'll play around with it and see what works best to make it easy for y'all. If y'all have any recommendations, please let me know. And nothing has changed. If y'all have certain topics that you struggle with and want me to cover it, like I always tell y'all, either shoot me an email, put it in the comments. I'm happy to incorporate those into our questions to help you with your studying and on your journey. But as always, let me get into my introduction disclaimer before we hit our questions for today. So, for those of you who are familiar with me, hey y'all, welcome back. Thank you for continuing to rock with me. And for those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock. I am a family nurse practitioner, and I'm the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, digital flashcards, and so much more to assist nurses and nurse practitioners with success on their boards as well as in practice. Y'all, I've been doing this since 2015, and it's crazy as it's 2025 that it's been 10 years that I have been assisting nurses and nurse practitioners internationally with exam success. I love it. We have maintained a 99% pass rate on all of our courses and a 100% pass rate on our one-on-one sessions. Um, this journey, as I was looking back over things over this past week or so, and just reflecting on the growth and the changes, and I just love it. And seeing all of you guys and the thousands of nurses and nurse practitioners that we have worked alongside of, to see y'all on y'all's journey, and just to receive the feedback. And even though we may be in different states, the referrals or us working together, or collaborating because we are in different specialties, or bouncing things off of one another, or reaching out to me about some cardiac questions or a cardiac patient, because y'all know that's my background. But I just love the community we have formed, and I look forward for the growing community that we continue to extend. I will be doing some upcoming things. Y'all see some stuff for affiliation and instructors. As we have merged together and grown together, I have some things that I will need your assistance with. So be on the lookout for that. But I'm not going to get on a whole rant right now. Let's get into our questions for today. But like I said, thank you, thank you, thank you. And if you have anything that you would like me to cover, y'all know what to do. Send it to me or put it in the comments. Let's go and be successful on our boards. All right, y'all. Question number one for today. A 45-year-old male presents with gradual hearing loss in his right ear over the past few months. On exam, you find that the patient's ear canal is occluded by cerumen. There is no evidence of middle or inner ear pathology. What is the most likely cause of the hearing loss, and what is the recommended treatment? Is it A, sensorineural hearing loss and cochlear implants? B, conductive hearing loss and removal of the cerumen? C, mixed hearing loss and hearing aids? Or D, otitis media with effusion and antibiotics? Take a moment and tell me what you got in the comments, you guys. All right, you guys. So, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is being asked of you. So, here, the stem of the question states, what is the most likely cause of hearing loss, and what is the recommended treatment? All right. So, let's see what's going on, because this is basically asking you for a diagnosis and a treatment, right? I always tell you, if it's asking for a diagnosis, you need to run it back and look at the assessment findings. How are they presenting? What are the chief complaints? What is noted on exam? And then also, when looking at those assessment findings, I tell you always to look at the age, the gender, and the ethnicity if provided, because this can aid in your diagnostics as well as your treatment, right? So here, this is a 45-year-old male. He's coming in with chief complaint of gradual hearing loss in that right ear. Been going on for over the past 3 months, right? And so on exam, the ear canal is occluded by cerumen and no other deficits or patho issues are noted, right? So the problem is the cerumen, aka the earwax, right? So remember what things can be considered as conductive hearing loss and what is sensory neural, right? So conductive hearing loss, B would be your best answer, because what's happening is that cerumen occlusion is blocking the sound conduction, right? The conduction of the sound waves getting through. This is a conductive hearing loss, and we simply need to remove the cerumen. B is your best answer. All right, question number 2. A 60-year-old female presents with a gradual loss of high frequency hearing over the past year. She reports difficulty understanding speech, especially in noisy environments. There's no history of trauma or infection. There's no visible abnormalities in the ear canal. What is the most likely diagnosis, and what is the most appropriate next step? Is it A, conductive hearing loss due to fluid in the middle ear, referred to ENT? Is it B, sensorineural hearing loss due to age-related changes like presbycusis, and we want to refer for a hearing test? Is it C, otosclerosis, refer to ENT? Or D, is this a normal finding? Take a moment and tell me what you got in the comments, you guys. All right, so step of the question here states, what is the most likely diagnosis and what is the most appropriate next step? Again, when they're asking for a diagnosis, you need to run it back and look at the assessment finding. So we have a 60-year-old female. She came in with gradual loss of high frequency hearing over the past year. She reports difficulty understanding like speech, especially in noisy environments. But there's no trauma, there's no infection, there's no visible abnormalities in the ear canal. So this is letting you know two things. Again, just like on question 1, I was telling you, like conductive hearing loss, there's something blocking that, right? Like cerumen, or a child has placed a pebble or something in their ear. It's something there blocking, causing this. Whereas with sensory neural, this is a neural deficit. And so here, what is noted is this has gradually changed over the past year. There's no history of trauma. There's no history of infection. There's no visible abnormalities. So nothing is noted to have caused this source. So your best answer is B, sensory neural hearing loss due to age-related changes. Presbycusis is classic, and this is what it sounds like that is going on. And we need to refer her out to have a hearing test. They can determine, how critical it is and if there's any other steps that need to be taken at this time. All right. And lastly, question number 3 for today. A 35-year-old male presents with complaints of hearing loss in his left ear. On physical exam, the patient demonstrates a positive Ryan test result on the left ear where the bone conduction is greater than the air conduction. And then the Weber test lateralizes to the left ear. Which type of hearing loss does this suggest? Is it A, sensory neural hearing loss, B, conductive hearing loss, C, mixed hearing loss, or D, central hearing loss? Take a moment and tell me what you got in the comments. All right, so stem of the question here states, which type of hearing loss does this suggest? All right, so we're talking about hearing loss, and I always tell when I'm working one-on-one with anybody, I say, y'all, think about it. You have a patient coming into you. They're talking about the changes in their hearing, right? They're noticing, they can't hear well in one ear versus the other typically is the chief complaint, right? So in this scenario, this is a 35-year-old male comes into the office and they're telling you, hey, I'm having hearing loss in my left ear. So you're going to need to go forward with this. So you're going to do the Weber and Ryan test, right? Which you're tuning for it. If y'all struggle with Weber and Ryan, go under my playlist to Weber and Ryan and watch that video. There's me breaking it down, showing you how to do it, and as well as the breakdown on how I try to help it make it a little bit easier when you're doing questions with it. But anyway, so you're going to do your Weber and Ryan test so that you can identify if there are any abnormalities, and then you want to be able to determine whether it's conductive versus sensory neural, right? So we do this Ryan test initially, and we're trying to determine if there's any abnormalities in either ear. So the normal finding is AC should be greater than BC, meaning air conduction should be greater than bone conduction, right? So whenever bone conduction is greater than air conduction, that's abnormal. So here, the Ryan test was positive in that left ear because it was abnormal in that left ear, right? And that's the ear that the patient is complaining about. So we're going to hold that because with that, it's showing us there's something blocking that sound conduction, right? Now with the Weber test, When you strike the tuning fork and place it in the center of the patient's forehead, they should hear the sound equally in both ears. If it lateralizes to either ear, that is abnormal. Here, it lateralized to the left ear. It lateralized to the ear that they are complaining about. Whenever it lateralizes to the ear that they're complaining about, that's a confirmation of conductive hearing loss. Whereas if it was sensorineural, it would lateralize to the unaffected ear, right? So in this scenario, the patient's complaining of hearing loss to the left ear. On the Weber test, if it was sensorineural, it would have lateralized to the right ear. All right, so here, bone conduction being greater than air conduction on the Ryan test lets us, think that this is probably a conductive hearing loss. And then we confirmed that it was because on the Weber test, the sound lateralized to the left ear, the affected ear, right? So your best answer is B, conductive hearing loss. And I always tell you guys about this scenario that years ago when I did the Barkley review, he spoke of this, and it always stands out to me and it helps. But he says, put your finger in one of your ears and like say anything. Say, hey, say I'm gonna pass board, whatever you want to say. And watch where the sound lateralizes. It's going to lateralize to the ear that you have your finger in plugging the sound. So no different if something's blocking it, if it's occluded with cerumen, if it's something in the ear, it's going to lateralize to that ear. Same thing with a conductive hearing loss. And I'm going to put the Weber video that I was talking about in the description also if you struggle with that so that you can see it. I wanted you to do the questions this way so that you can first identify just the basic knowledge of how to identify conductive versus sensory neural. But then I also wanted in a scenario based that you can answer the question when you're walking through as if the patient is in front of you and doing the Weber and Ryan test. So I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any other resources that I do offer, feel free to reach out to the nursing studio by giving us a call to 803-400-6864. You can also shoot a text message to this number or shoot us an email to thenursingstudio, the number one at gmail.com. All of the things that I do offer are linked in the bio of this channel, including my website. And if you're looking to book any of my one-on-one sessions or customized plans, I always say either call, text, or email so that I can speak with you to gauge what you truly need to make sure you're booking the appropriate session type, okay? All right, you guys, y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.